I am Groesbeck Parham, a gynecological oncologist in the Department of Obstetrics and Gynecology at the University of North Carolina, Chapel Hill. My work is in Lusaka, Zambia, which is an African nation of about 16 million people that is located in southern Africa. The focus of my work is saving lives of women and girls in Zambia from the dreaded disease of cervical cancer by providing them with opportunities for early detection and treatment. At the time that I arrived in Zambia, only 10,000 women had ever been screened for cervical cancer. And since that time, since we started our cervical cancer screening program in 2005, 2006, over 600,000 women have been screened for cervical cancer, and over 20,000 have been treated for cervical precancer, and hundreds for invasive cervical cancer. My goal in Zambia is really oriented around creating practical public health solutions for women's cancers, not only in Zambia, but other low-income nations in Africa. When I say public health solutions, I mean solutions that can be accessed in the public sector by the vast number of women who are at risk for cervical cancer. There's a need for cervical cancer screening. There's also a need to train surgeons, cancer surgeons, who can perform proper surgery on women who are found to have very early stage cervical cancer. But we need surgeons who are able to provide surgery for those women, because those women can be cured with surgery alone. We also need laboratory support in terms of pathology. One of the biggest roadblocks is not having enough pathologists in the country. So we need to set up a pathology system. And then for breast cancer, which is the second most important cancer in sub-Saharan Africa, soon to be the most important, we need to be able to train surgeons who can do proper breast surgery and do the diagnostic test. Someone recently asked me about philanthropy, and I don't like the word philanthropy. I would rather use the word investment, because what we want to do is put resources in an idea, invest in people in such a way that they will be able to sustain the program and sustain themselves after we are long gone. So I think, we need to do what we can to support women, not just in terms of preventing them from getting these diseases, but once you've prevented the disease, now what? Does she just go back on the street and she's the same poor woman selling the same thing, and she comes back the next day and she just makes enough money to survive? The question is, what can you do to elevate her so her socioeconomic status improves? A lot of these problems that I'm talking about are due to poverty, and unless poverty is alleviated, we'll always end up doing the same thing over and over and over again. The other thing is the gratefulness, the gratitude of patients. It's just unbelievable. Sometimes I'll be sitting in my office, and a woman who I've operated on years ago, done surgery on, will just stop by my office and she'll say, "Professor," that's what they call me, "do you remember me?" "Yeah, I remember you." She said, I just stopped by to say hello, and just to say God bless you, that I'm praying for you, and thank you very much." And then she walks away. And some of the poorest women I've ever seen in my life, you'll see them sometimes on the streets, and they'll just run and just grab you and hug you. They're just so thankful. And so it has made me really appreciate the power of being a physician, and how important it is as a physician to be an advocate for patients in that environment. Because if you don't advocate for them, sometimes they die. You're the only thing that's in between them and death. If you don't fight for them to get a blood transfusion, or fight for them to get antibiotics, or fight to get a lab value, they'll die. But we need resources, because at the end of the day, everything that we're doing is is making an effort to save the lives of women so they and their families will have the opportunity for growth and development. It's an investment, and I guarantee you, you'll get the results back a millionfold, a trillionfold. You may not be able to see it in your lifetime, but keeping a mother alive is just central to the development and sustenance of the family, the children, and the economy.